Hello everyone. So this is Dr. Shubhanshi, Senior Lecturer in Department of Prosthodontics, Crown and Bridge in the College of Dental Sciences, BBD University. So today I am going to take a lecture on provisional restorations in FPD. The topic which we are going to study is about the introduction, about the requirement for fixed provisional restoration, types of provisional restoration, various technique of fabrication, provisional crown for laminate and veneer, and the removal of provisional restoration. So one by one, we will read about the content. First comes to the introduction. Introduction, basically, it is also called as interim or provisional or treatment processes. Whenever we are giving patient an FPD, a definitive restoration, so before that we have to give a temporary restoration for the time being. So provisional restoration and fixed prosthodontic rehabilitation are important treatment procedures, particularly if the restorations are expected to function for extended period of time or when an additional therapy is required before the completion of rehabilitation. Thus, in order to protect these prepared abutment, provisional restorations are fabricated and process is called as temporization. So basically, whenever we are preparing an FPD, we have to, before giving the definitive processes, we have to give a temporary processes. And the process of making temporary processes is called as temporization. The term provisional, interim, or transitional have also been routinely used interchangeably. The word provisional means established for time being, pending, or permanent arrangement. Now comes to the definition. According to the GPT-9, provisional prosthesis is a fixed or removable dental prosthesis or a maxillofacial prosthesis designed to enhance the aesthetics, stabilization, or function for a limited period of time, after which it has to be replaced by definitive dental or maxillofacial prosthesis. Often such prostheses are used to assist in determination of therapeutic effectiveness of a specific treatment plan or form and function of planned definitive prosthesis. Now comes to the objectives of provisional restorations. Firstly, Firstly, it is to protect the tooth from pain stimuli as a result of thermal, hot and cold, chemical and osmotic changes in the mouth. So when we are preparing the tooth, most of the enamel is removed. Now the dentine is exposed. That dentine is sensitive to pain, hot and cold or chemical changes. So this point refers about the pain stimuli. Now next, second point is to prevent the sensitivity and irritation to pulp. If these stimuli, such as hot or cold or chemical stimuli, persist for a long period of time, that may cause damage to the pulp. So it is necessary to provide a temporary crowns over the prepared crown. Third, to prevent the movement of prepared adjacent and opposite teeth, that is to prevent supra-eruption and drifting. So after preparation, there will be space. So it is according to natural phenomena of tooth, it is required to close that space. So there is a supra-eruption of the opposite teeth. When there will be supra-eruption, also there will be space in the adjacent teeth. So there will be drifting of adjacent teeth. So it after temporary crowns, we can protect the drifting and supra-eruption of crowns. Next is to protect the gingival tissue from the irritation and food impaction. Basically, we have to protect the gingiva from, we can protect it by swelling, and so that there will be no swelling in gingiva. Fifth is to provide aesthetic, phonetics, and function. So when we have prepared the crown, aesthetic is very poor, phonetics is very difficult, and function is impaired. So we put provisional restoration and we will restore all these three function: aesthetic, phonetic, and function. Next is to prevent the tooth fracture. So if the prepared tooth is left like this for long period of time, it may be subjected to occlusal force. That leads to the fracture of prepared tooth. So these were the objectives for the provisional restorations. Now come to the rationale of provisional restoration. According to Frederick and Crew, they have given some points. The first is to protect the pulpal tissue and sedate prepared abutment, protect teeth from dental caries. Of course, we have to protect the teeth from the dental caries once the tooth is prepared, and if there will be any caries, so we will give the restoration, we'll give the temporary restoration, and will protect from dental caries. It provides comfort and function, as we have studied earlier, that it provides better function, phonetics, and aesthetics. Now, evaluate parallelism of abutment. That point was also taught that there will be drifting or shifting or supra-eruption. So evaluate the parallelism of abutment. It provide method for immediately replacing of missing teeth. So when we will prepare the tooth and patient will go like this only, so it will not be aesthetically pleasing. So it will give immediately replacing of missing teeth. It prevent migration of abutment. Okay, it improves the aesthetics. It evaluate and reinforce the patient's oral home care. It provide a matrix for retention of periodontal surgical dressing. It stabilize mobile teeth during periodontal therapy and evaluation. It provide anchorage for orthodontic brackets during the tooth movement, and also it allow the evaluation of vertical dimension, phonetics, and masticatory function. Now the indication of provisional restoration. Diagnostic. Prior to making the final restoration, it may be advisable to determine the prognosis of pulp and periodontium of prepared teeth. So whenever we are restoring, we have to look about the pulp and the periodontium of the prepared teeth. Now, protective. Cut dentine and associated pulps are protected from salivary, thermal, and chemical irritants. The gingiva is also protected when restorations are properly formed. In restorative case is replacement of teeth, especially immediate anterior replacement. Immediately they will get temporary crowns which will be aesthetically pleasing. Stabilization or provisional splinting. Stabilization is of great importance in a treatment of periodontal weakened teeth. So basically, if the teeth are periodontally weak, we will do what we will be giving. We will be splinting that. We will join them, so it will leads to stabilization. Now, requirement of provisional restoration. Basically, there are three types of requirement. Main one is mechanical, biological, and aesthetic. Mechanical requirements include resist of functional loads and resist of removable forces. Biological requirement include that it protects the pulp, it maintains the periodontal health, it provides occlusal compatibility, it maintains the tooth position, and it protects against the fracture. Aesthetic is the one of the main concern. So we have to look about the contourable. It is contourable along with the adjacent teeth. Color stability, we have to match the color of adjacent teeth. There should be some degree of translucency in this, and texture. So these are three main requirement which we have to fulfill during our provisional restoration. Now comes to the types of provisional restoration. Basically, basically it is a classification. So there are four types of classification. First one is method of fabrication. Second is types of material used. Third is technique for fabrication, and fourth is duration of use. So we'll be studying one by one in detail. First classification is depending on the method of fabrication. It can be either custom made, or it can be preformed or provisional. It can be preformed or prefabricated. Preformed or prefabricated means we are getting it from the market and directly we are placing it into patient mouth. Custom made, which we are making, that is custom made. Now, based on the duration of use, it can be short-term temporary crowns or long-term temporary crowns. So short-term temporary crowns are which we are using for the short-term short period of time, and for long-terms are which we are using for the long period of time. Basically, long-term temporary crowns are used in the case of full mouth rehabilitations. Now, depending upon the technique of fabrication, this one is very important, that in this only we can decide how we will be fabricating our provisional restoration. It can be used by direct technique or indirect technique, or combination of both direct and indirect technique. These techniques are very important. We will be discussing this later on. Next is based on the material used. Materials basically they are either of resin based or metal based. So we are using resin based, then it can be of cellulose acetate, polycarbonate, or microfilled composites. And if it is metal based, we can use aluminum, nickel, chromium, or tin silver. Now comes to the types of temporary crowns: preformed or prefabricated crowns, or custom provisional restorations. So basically, preformed crowns consist of a shell of plastic or metal that could be cemented directly on the prepared tooth following adjustments or after its lining with the resin material. While custom made provisional restorations are those that made with matrix derived from original tooth or modified diagnostic cast. Now, types of prefabricated crowns. Types of prefabricated crowns. They can be metal temporary crowns, plastic temporary crowns, and celluloid crowns. These are the metal temporary crowns. This one is plastic temporary crown, and this one is celluloid crown form. Basically, these celluloid forms are mold in which we will be filling our material and will place it in the patient's mouth. Okay, thank you everyone. We will be continuing this topic on the next lecture.